Another common mistake that people make as they move into retirement is not planning for healthcare. The reality of it is the cost and the level of care that you will need throughout retirement are going to fluctuate, and in some cases, pretty wildly. For example, if you retire before you are Medicare eligible, which is currently at the age of 65, you may have a need for private health care. Now, generally speaking, at this stage of retirement, you're usually pretty healthy and your healthcare concerns may not be that great. However, the cost of private healthcare is going up more and more every year. So if you have a need for private insurance, your healthcare costs, just the premiums alone, could top over $30,000 per year in the United States. Once you turn 65 and you're Medicare eligible, healthcare is not free, but your costs definitely go down. But now we have a little bit more of a complicated landscape to navigate. Medicare has multiple parts. Part A covers hospitalization. That actually is free for all people who are on Medicare. Part B is our doctor's visits and our general medical care. And Part D covers our prescription drugs. Part B and Part D, our prescription drugs and medical care, do have a premium that is dictated by whatever our income is. To add insult to injury, our Medicare premiums are not in alignment with the tax brackets, so you literally could be in one tax bracket but be in a much higher Medicare tier than you anticipated you would be in. In addition to that, Medicare tiers are delayed 2 years because they are based on our tax filings. So our Medicare premium for 2027 will be based on our 2025 tax returns. In addition to all of that, you may also need supplemental insurance to cover the things that Medicare does not. It is highly recommended that you work with a Medicare specialist that can explain to you what your options are and what's appropriate for you in your situation. Lastly, as we move even further into retirement, long-term care may become an issue. Long-term care policies are best purchased when you're younger, but even today, freestanding long-term care policies that are available are much less frequent and they become very expensive. And that's a lot to pay for something that you may not need. Looking into hybrid products, these would be like life insurance policies or annuities that have what we call a chronic healthcare rider or have a long-term care option or benefit with them, may be a better way to go. Lastly, you may want to look at designating an asset that you have, like a retirement account or an annuity, that will help pay for long-term care costs should that situation arise. It's actually pretty easy to avoid these common mistakes in retirement, especially when you have somebody working with you at your side to help you navigate through these various financial landscapes. If you have a question, you can go ahead and drop it in the comments below. Contact us directly on our website, myincomeplan.com.